If you have a meniscus tear, can you play sports or exercise before you undergo surgery for it? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist. I provide education, information, and commentary on all sorts of sports and exercise, injuries and injury treatments, and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. I get hundreds of questions every month about meniscus tears. It's so common. It's, one of the most common injuries in all of sports medicine. It's so common for athletes and active people to suffer a meniscus tear, and the surgeries are among the most common surgeries that orthopedic surgeons do. And I've talked in other videos about why that is. Basically because people largely can't do what they want to do with the meniscus tear. It very often doesn't heal on its own, so we talk about surgery to treat it. But what can you do up to that point? Are you doing any harm by continuing to play your sport or do your exercise? In this Ask Dr. Geier video, I answer that very question from somebody who wants to play golf. Okay, Stefanie asks, I'm a serious golfer playing 3 to 4 times a week. I just found out I have a large horizontal tear in the inside meniscus on the right knee. I'm waiting to get in to see a surgeon next month. Can I still play golf or should I rest it? That's a terrific question, and I think that if somebody is not having symptoms that limit their ability to do it, I think it's generally okay to keep playing. Now, the trick with golf and meniscus tears is that golf involves a swing, and so there's a lot of twisting forces on the knee, and that's one of the motions that not only causes the injury, it causes a meniscus tear, but it also aggravates people with it. In fact, that's a lot of times the more common complaint. They can walk straight ahead fine. They may be able to jog straight ahead fine, but when they go to change directions, they plant their foot and twist on it. That causes this sharp, really annoying, really uncomfortable pain with the meniscus tear. And so that would be the interesting thing. But if you try to go out and play golf and it doesn't give you that much pain, I think it's absolutely fine. Now, it may not be golf, it could be running, it could be lifting weights, whatever your activity is. For a meniscus tear at least, generally, if it's not limiting you too much, I don't think there's that much harm in it. If you do try to go back and play and it's just this really sharp pain and you just can't do it, then I'd argue maybe you modify your activities a little bit. Find a different sport to play, find a different exercise to do, or just modify the moves in that exercise or type of sport, and you might be able to do it. Now, one question I get, and this is fair to ask, is, well, am I doing more harm to it? Am I making the tear bigger? And I don't know that there's a huge risk of that in adults. That may be true in young kids, maybe even up to the high school or college age, but even that is debatable. But definitely in adults, is there a small risk you could propagate the tear and extend it, make it a little bit bigger, and then you need more taken out? Potentially, but I don't know that that justifies 3 or 4 weeks or longer of being sedentary either. I generally think if you can do it, then you could probably continue to exercise and then deal with the tear according to whatever you and your orthopedic surgeon decide. Have you had a meniscus tear? And did you keep playing sports or did you keep exercising through it? I'd love to hear your experience, so below this video, share your experience. I'd love to read it, and I bet people all over the world would love to hear your experience and how you dealt with it as well. If you like videos like this and you want more information on sports and exercise, injuries and injury treatments and injury prevention, subscribe to my YouTube channel. There's a subscribe button in the upper right corner of this page. Definitely click on it. I record a couple of these videos every single week and they'll get delivered directly to you. If you know somebody dealing with a meniscus tear, please share this video. I want to help as many people as possible, so share it with them and hopefully they can make a decision that's best for their knee. Thank you so much for watching. I really appreciate it, and I look forward to seeing you right here next time.